Hey everyone, it's Sarah and welcome back to this pregnancy vlog series. So in this video, I'm going to do a quick review and talk about marginal cord insertion and my experience with it during this second pregnancy. Because I know there's other women out there who have marginal cord insertion, so I want to talk about what that means and what it means for you and your baby. So what is marginal cord insertion exactly? Well, it deals with that umbilical cord that's leaving baby and attaching to the placenta. So first let's talk about the placenta. Well, the placenta is like a very important organ that sustains your pregnancy and it helps your baby grow. So the placenta attaches to your uterine wall, and in a sense it like taps into your blood supply and removes nutrients that you've taken in and gives it to the baby through that umbilical cord. And then the baby will use it up. They will produce their own waste, and then that waste will travel through that umbilical cord, go to the placenta, and you'll get rid of it. So normally that umbilical cord should insert like right in the middle of that placenta. And why we want it to do that is because it's going to have the most access to placental tissue. So you're going to get good blood flow, baby's going to get nutrients and grow really well. Now the umbilical cord can attach itself in different places. It can have a mind of its own. And in my case, it attached marginally, which means instead of going and attaching in the middle, it decided to attach in the edges. Now, what's the big deal about this? Well, whenever that umbilical cord attaches at the edge, it's limited on the placental tissue it has access to. So a complication that can arise is that your baby won't get all the nutrients it needs, so it won't grow very well. Now, to monitor this, what your OB provider is going to suggest is that you have routine ultrasounds. And this was actually discovered at my 20-week ultrasound, where you go and get the anatomy scan where they look at your baby's organs and then they tell you if you want to know if you're having a boy or a girl. And this is where they discovered this. So my OB doctor recommends that I have like these ultrasound scans just to monitor baby's growth, look at their amniotic fluid. So we have been doing that and everything has been looking great. So about every 4 weeks I have an ultrasound, and at my very last one, about 36 weeks, he was measuring 5 pounds and 14 ounces. And based on that, he's looking like he's going to be about a 7-pound baby at about 39 weeks, which is great. I'm very excited. My first baby, we didn't have marginal cord insertion, and he was like 9 pounds 1 ounce. And this baby, if it's 7 pounds, I will definitely be excited about a 7-pound baby. So whenever I figured out that I had this at that 20-week ultrasound, I was a little bit shocked because, like I said earlier, it wasn't something that I had with my first pregnancy. And the biggest mistake you can do is to get on Google and research it, because I'm telling you, the worst case scenarios are on that place and will scare you half to death. And I really recommend, if you do have this, like, talk with your OB provider and let them answer your questions. Don't really go to Google, because you're going to get stressed and you don't need extra stress, because everything so far has been turning out great. His growth is really not being affected by this. And I try to look at the pros and cons of everything, and a big pro that has actually came out of this is that we've had these routine ultrasounds and I've been able to see him grow, see different pictures, and I get that reassurance that he is measuring well. My amniotic fluid is great, and if you have other problems, they can detect that as well, because at one of my latest ultrasounds, we found out that he was in the breech position. So, just try to look at the pros and cons of it and always talk with your OB provider. Okay, so that wraps up this review over my experience with marginal cord insertion, and I hope this helps you out. And if you do have this, maybe you want to share in the comment section below your experience with it. And also, I have a pregnancy vlog where I've been keeping track of this pregnancy, where you can check out the other videos and the other little complications I've had with this pregnancy and just follow along. And thank you so much for watching.